Guess who? It's me again, guys. I'm back earlier this morning. I recorded my fourth video, and now I am continuing on with the fifth, entitled Anxiety, Paranoia, OCD, and the Drugs Used for Them. I wanted to let you guys know that there were some changes in my life health-wise, and I just wanted to give you a little feedback or information on my health regarding how I've been feeling and what's led up to this point that I'm at now. One thing I didn't mention on the last video was that I also have to well, I've got to see an orthopedic for my knee, an orthopedic surgeon. I don't know what's going to happen with that, but the other thing is sleep apnea. I'm going to have to get a sleep study done because there's a lot of things that are happening. And my father had sleep apnea. I mean, he would literally stop breathing during his sleep. I don't really wake up gasping for breath. It's just that I can be in the motion of walking regardless of where I'm at home, work, whatever, non-strenuous activity, and all of a sudden I will make this gurgle noise, like it's as if my tongue is or something is blocking my windpipe just for a split second. It's not like oh my God, I can't breathe, It's not like that. It's kind of spooky though, and it's starting to happen more frequently. So that's another thing I'm going to have to get tested for. Now, I don't want to sound like a hypochondriac. I mean, I'm not. This, you can't, I knew this guy once I used to work with at a little independent place, and he always would say, you can't make this shit up. And I'm telling you, you can't. It's just I've always had this saying that there was a show called F Troop that used to be on, and like I said, I don't know how old my audience is, how young you are. If you've seen any of the old reruns on any of those Nickelodeon channels or any of them, there used to be a show called F Troop, and there was a particular character in this show called, his character name was Rongo Star, and poor guy had nothing but bad luck. I swear to you, I believe that I'm related to him. Just a thought. Anyway, so I am still smoking. I do have the electric cigarette though. I'm not smoking it right now, but I gotta put it on charge. It needs to be charged. I know that sounds like an excuse, but it does need to be charged. And so that's something that I do use on occasion to try and trim down my smoking. Now, to get back on the actual topic of the videos, I kind of like to go back to the anxiety just to again stress that anxiety is a very serious, I don't know what you want to call it. If you want to call it an illness or something that happens to a person, it's serious and it's very uncomfortable. I mean, when you're anxious and you can be anywhere. I mean, you can be at work, you can be shopping, at a friend's house, sitting having some coffee. I'm not having coffee this morning. Actually, I'm drinking Crystal Light pink lemonade in my purple straw because purple and teal are my favorite colors, but purple really is. Not that that mattered anything, but anyway, when you're anxious, sometimes it's very hard to to cover that up, because uh, when your whole body feels like you want to just jump out of it, and trust me, it will, if you're anxious and worrying and wondering with all the what ifs. That's pretty much what you go through. Your heart's palpitating, your blood. Sometimes I used to say my blood was jumpy because it felt like my blood was jumping around in my body. You feel like, I've never experienced a heart attack, but I'll tell you what, when you have an anxiety attack or a panic attack, it'll make you feel like you're having an actual heart attack of some sort, because your body is going through all of these different changes. And I never quite understood it, but now I do fully understand that it is called the fight or flight response. And it's a necessary thing that your body's going through, to prepare yourself, whether you're going to fight or flee. And it just is, there's so much going on in your body at that moment, but it's called the fight or flight response. And you're either going to fight the feelings, which is not very easy to do, or you're going to try and flee from them. And the more you try to flee from them, the worse the anxiety is. So really, it is very important to try and embrace. You should try and embrace the anxiety. And I know this, and I'm trying. It's just that it's extremely hard to do when you're going through the attack. After the fact, thinking about it, you may say, well, I could have, would have, should have. But when you're going through it, baby, I tell you, it's just not happening. I'm sure that you can get to a point where that can happen if you get strong enough. If you work on it enough, maybe with your doctors, through your medications, maybe with counseling, maybe with these different, there's a lot of different methods out there now, that I've seen. Just a few that are on the top of my head. The Linden method, I've never tried. I did view a few videos about it. Panic Away, that's another one, which someone did play a portion of that. And I'm not going to say who it was, because I don't know if they're going to get in trouble for it or not. And I'm not going to say what it says to do, because the man's trying to make money, and I'm not going to try and stop that from happening for him. But there are some very good exercises that he brings to the table. And I suggest looking into the Linden method, looking into Panic Away, and they may help you. There was another thing I saw, but I can't remember it right now. But there are many different helpful resources out there. Oh, well, Derek Soto is another person that is all about anxiety, and OCD is basically what he's on. And I tell you, I highly recommend him. I've watched some of his videos. Of course, it's easier said than done, and everything takes work, and he does say that. And if you don't work at it, nothing's going to happen. But I'm going to take a short break here. I'm going to come right back because, like I said, I wanted to get more into the anxiety. There's a few more things I want to talk about, and then I want to move on to another portion of the video subjects. So I'll see you in just a bit. Thanks for watching.